What's up, fam? Just took a shower. I'm in my Chicken Brothers apron, and you know what that means. It's time to not chicken out. And let's talk about health insurance. Let's get the important stuff out of the way first. 1 second. One light. There we go. Oh no, it didn't light. 1 second. Fuck it, I'll just use my hands. It's pink sugar. That's why I want to light it. Because it smells really good. Just gonna put you right there. Okay, so first things first, obviously I don't want to get sued, so we're just going to make this very simple. I had about 2 years in experience in health insurance between UHG, another company, that were both fairly large. I was in charge in monitoring the employee health policies. However, we saw a variety of plans. Usually there's about 3 types of plans. I am not going to be acting as a fiduciary body. What is a fiducie or a fiduciary? Very simply put, it is somebody that is offering or speaking to you on behalf of your party, etc., that is offering like legal advice. That could be financial, it could be in regards to your health, etc. Why do I say that? Everything, of course, you want to make sure you verify with your insurance company. Speak to them directly. Usually it's going to be offered through your HR. Hopefully it's internal. If not, it'll be placed through a specific company. People like Aetna, UHG, of course, offers a big branching insurance pathway for both their employees and for their non-employees. Let's have some water. 1 second. All right, so we're back from the hydration station. Real short, real simple concept. There are 3 types of health insurance policies. Which one's right for you? Well, honestly, it's hard to say. Oh, my hair looks like crap. 1 moment. I made it more like crap and less like crap at the same time. Conundrums. Okay, so as I was saying, you have 3 types of pretty easily different or varied forms of insurance that are most popular. You have a PPO. You could think of that as like a preferred physician network. The easiest way to say is you should go to this number of people in our network. It could be like the UHG brand where you can go to any of these hospitals and you can visit, but it's pretty open. We call it like a broad network, so to say. Anyone in this hospital, that's it. And that's pretty easy to understand. You just go through and select. There's a POS, which is a point of service. And it's kind of an in-between that and the next option. So I'll discuss the next option first, because structuring and scripting. The next option I guess I'll talk about is an HMO. So an HMO is going to be more of a maintained network. Basically, the way you can think of an HMO is you will get service if you go to this specific doctor in this specific network. And that is usually going to be your primary care physician. Now, why is it important if you don't know what an HMO is or how that works? Basically, and unfortunately, if you go out of network, if you go to a doctor that's not been recommended for referral from your primary care physician, or if you don't set a primary care physician, they may not offer any coverage, meaning you pay entirely out of pocket. Is that fair? Seemingly, but they have those restrictions for a couple of reasons. One of the reasons that PPOs are generally more expensive in terms of visitation is because they do have that broader aspect, whereas an HMO is usually set with copays. A PPO is usually set with deductible out of pocket. I'll explain all that later, but essentially it's more of an at front or a backloaded cost. And the backloaded cost for the HMO is cheaper because most of the time you are able to see only very specific doctors and their patient loads are set to a specific point. That allows for those referrals to cheapen the overall service, and thus your overall cost for the insurance is a lot lower if you were just looking at your initial visitation cost. Again, it's set copays. So you think of like an HMO, you pay $50, you're there, that's it. Unless it's maybe like a specialist. Now, one thing to keep in mind is that we have a third option. That's called POS. Now, POS is kind of the in-between point. There's some instances where you may have those copay features that are being set up. You may have to pay towards a deductible. It depends on the network and it depends on the service. I've seen a couple that are a little bit different. We also have some that are kind of in between. There's like buy-up options I can discuss in a little bit and things like that. Generally, a POS is going to be a little bit more open, and a lot more freedom than the HMO would be. So you have to see specifically this network, whereas the HMO has no out-of-network, that's to say no benefits or no paid coverage. If you didn't see this specific doctor or a referral set from your specific PCP, they would have access to that. So that's one good benefit. And they usually do have copay features as well. There may be some instances of deductibles. That just depends on the policy, and there's certain things that go through. POS are a little bit more of like a hybrid between the two. So some of the features are between both parties. Now, one thing to keep in mind is that for most plans, I haven't seen any that do have it. I don't want to speak as though I know 100%. The deductible that you might pay for especially a PPO or your out-of-pocket max, that does not include prescriptions. So just keep in mind, let's say you have a chronic illness or you have a condition that does cause your overall cost to be higher because maybe you have like insulin or certain things. That prescription may be covered, and you might have different tiers for your plan, and we can discuss that later. But the overall amount for what is being paid, so let's say you pay $150 for prescription refill every 30 days, right? So you get a 90-day supply, and it's mailed to you. Maybe you get an RX discount. So maybe you're paying like $360 for that. That $360 does not go into your deductible in most cases, just so you're aware. Now, it also doesn't usually pay into your out-of-pocket max either. So just one thing to keep in mind with those. Now, again, I did mention that your PPO is generally the most broad spectrum plan. You might see these being called high deductible health plans, or ADHP as well. Basically what that means is your employer has set, or your standard, whoever it may be, has set a deductible. Now, deductible has a couple different things for things between car insurance and health insurance. Health insurance, it's like you have to hit by a year, and usually it's a rolling 12. So it's January to December 31st is how it works, and then it resets of the year. Some plans, it's not. For UHG, for example, the dental plan used to be, it was a rolling 12 from the date of inception of the plan. What that ultimately means, you have to speak with your plan just to confirm, but you might hit your deductible early on, and then you have the rest covered. And it's at a coefficient or co-insurance usually with a PPO. So what does that ultimately mean? So let's go into an example as a breakdown. Your deductible for your PPO is $1,500 for yourself, and it might be $3,000 for family. It's usually that it is twice as much, and then your out-of-pocket max is $3,000. We'll go over a chart to show how this math works, but basically, let's just say you have $1,500. So you pay out-of-pocket, no matter what the medical expenses are, until you've paid the $1,500, and then you're also paying the bi-weekly. Let's say you get paid every 2 weeks. That's the standard for most people. You pay the bi-weekly amount for your premium. Now, premium and deductible are completely separate amounts. Premium basically means that you are paying exclusively for the right to be on this plan and to have this health coverage. Now, your employer is usually, honestly, going to pay a lot more if you were to look at the rates. Now, you could say with UHG, they're paying $500 per check on your medical premium, but how much does that cost them? Well, I don't know. But your deductible is the $1,500. Let's maybe say you pay $75 per check. So your $75 per check doesn't pay into that at all, as I mentioned. And then maybe you have 2 hospital visits, and they're $750 each. You pay that, and then from there on, anything beyond that $1,500, you still have to pay a percentage for, but you would look at what your co-insurance rate is, if you have a co-insurance rate. And your co-insurance rate, let's say it's 70%. That means that the company will pay 70% and you pay 30%. So you've met your deductible, you paid the $1,500, and then let's say you have another visit for $1,000 this time. Well, they pay 70%, so they have $700 that they're paying directly as part of the medical claim once it's submitted. You then pay $300. and that's the bill that you would receive. Now, at this point, you've paid $1,500 into the deductible, and you've paid another $300. So your overall out-of-pocket expense was $1,800. Now, keep in mind that that's important because most plans or policies will have this out-of-pocket max figure. Now, it's in UHG, I saw it was usually like 3 times the deductible, depending. It really did depend on the plan, though, because there was like a low deductible plan, a midpoint, and then a high deductible plan. And you might see that, and we can go over the price differences and how that kind of works out. It really depends on your health needs to determine what's best. Now, I wouldn't give advice, but I can kind of outline how my thinking on it was. We weren't permitted, as I wasn't in sales, to give advice, but you can guide people towards the information, and then they are informed to probably make the needs-based decision for themselves. So this out-of-pocket amount in this expense example that we had, it was $1,800. So let's say their out-of-pocket after the deductible is $1,500 is just $4,000. That's not really likely. That's 2.5, so probably not correct, but let's say it was the $4,000. So they've paid $1,800. That means they still have to pay $2,200. Now, they're paying 30% on this until they pay an additional $2,200 for the remainder of this year. And that means that they then have to still pay that in addition to any kind of prescription costs. And then they're usually covered at 100% after they've met their out-of-pocket max. So that's generally how a PPO would work and how it's going to be structured. Now, you would think, how do I take advantage of that? Or how do I lay down on my stairs lazily and get a headache? And the answer to that is don't. Oh, is this not? I didn't pause it. It's literally going to hang from my head for a second. Okay, so let's say we've got an example of just do the full 26 pay periods, right? And then we've got our deductible, which let's just say that is going to be, I don't know, $1,500. Or actually, $1,000's an easy base 10 line that we can use for this. And then we've got times, let's make it easy, $50 for our overall cost per premium check. So 26 times 50, or you could say 13 of 100, it's 1,300, right? And then what we've got here afterwards is another 1,000, right? Now, in this example, your out-of-pocket max is possibly going to be, I don't know, if your deductible is 1,000, let's just say it's 3,000, just for safety of numbers. Now, this is not a realistic example, just so you're aware. But basically what this means is you're paying the 2,300, right? So a total of 2,300 here, less than or equal to the 3,000. Now, if you're going to use your plan and you're only going to meet your deductible, then you have lost $700 in a possible or a tangible difference here, because there's a $700 difference between what you do have to spend and then the out-of-pocket max. Now, that means that if you're spending, you have to hit another $700, I would say. It's not necessarily a loss, but it's a virtual example of what can happen. Ow. Oh, I'm dumb. I'm so dumb. Anyway, that math may not make sense, but essentially what you want to see is based on your medical needs. You can determine if, while you're walking towards your washer and dryer combo for no ostensible reason, if you are more likely to be ill, or if you know that you have a upcoming surgery, pregnancy. I couldn't tell people, but I'll say this. If you're a mother and you have the ability to go to a lower deductible plan, you'll spend less money. And usually your out-of-pocket max for the lower deductible is going to be lower. The reason for that is because your premiums are higher, and that's usually how they're balanced out. So let's say we have those 3 plans I mentioned with UHG. That's just an example. We could just say the midpoint, the mid plan, we've got the low premium and the low deductible. Okay, well, so the low deductible, just as an example, that deductible is going to be $1,500, right? And then your out-of-pocket max is $4,200. Well, let's say 16 and 42. So 1,600 and 4,200, right? Your midpoint, let's say the deductible is 2,800, or let's say 3,000, just to make it easy, right? So I guess what we'll do, let's modify it slightly. Low deductible, 1,500 and 4,500 out-of-pocket max. Easy, even numbers. Midpoint, let's say 3,000 and let's say 6,000. You'll notice that there's a difference between the out-of-pocket max. And that's honestly to save the company money. You'll see that usually lower deductible plans have an out-of-pocket max, which is still equal to, but not necessarily going to be the same. So you have to do the math on this. And then the high deductible or the low premium plan, they may name it, is going to be something like, I don't know, 6,000. And then it's going to be an out-of-pocket max of 12,000. That's not unrealistic, by the way. There are some times where that happens. What you will see is that the low deductible plan may be twice as much or even more in terms of the cost. But let's again look at the examples that we have. Let's say it's $100 for the low deductible plan for just you on that plan. And you have 26 pay periods, so it's $2,600. Your out-of-pocket max is completely unrelated to that, but it still serves for this math. In this case, you take the $2,600 as just a baseline value that's completely removed from the equation until the very end. And then you take your overall cost for the deductible, $1,500, not bad. But let's say you're chronically ill and you're automatically going to meet that. You're going to hit your out-of-pocket max. So if you pay the $4,500 in medical bills anyway, anything after that point is automatically satisfied at the 100% sans your premium. So it's just going to be a mathematic value of $4,500 plus the $2,600, the $100 per paycheck, so $2,600, and the $4,500 for your out-of-pocket max. On the flip side, if you were to have the low premium plan, maybe you're only paying $33, 1/3 of that. So your overall in this instance is going to be 33 times 26. Mathematically speaking, you just take 1/3 of that 2,600. So it's going to be 800 is 24 and then 66. So $866 for the year. Not an even number, unfortunately. So a little bit harder to do in the example. And then you'll take your overall deductible, which is going to be another $6,000. And then you have your out-of-pocket max, which is $12,000. So you see how in this instance, you're spending a max of $12,000 for your out-of-pocket max, and then you're only spending $866 on your premium. So you think in the short term, the premium saving that money will offset the cost, but those balances just don't add up most of the time. Check with your employer, and then basically, again, you just take your out-of-pocket max, and then you add in the monthly or the weekly cost of your premium, whatever it might be, and then multiply it by either the amount of months in the year, so 12, or your paychecks. And you'll see that that equation can be used to break down what your overall effectiveness is. Now, if you're a perfectly healthy adult and you don't have any expected expenses, that low premium plan, and maybe the $6,000 isn't the right number. Maybe for your company, it's like $4,500. You get a car accident. You find out you're pregnant in March and your due date is in December. You won't hit your deductible. There's no way you'll hit it if you're a healthy adult, or so you think. Aside from a catastrophic event, what you can do then is you can plan or you can determine that the low premium plan may be for you. And it's sort of an at worst case scenario. So you and your family, perfectly healthy. It's just a low premium. You're only paying that $33 for yourself per paycheck, or maybe it's $67 for your family, rounding up here. What that essentially equates to, or what that means for the breakdown, is that, you'll pay more possibly, but you might end up saving money. And if you don't need it, maybe this year you don't have anything. Next year you don't have anything. The year after, you got a surgery, switch your plan. That's what open enrollment's for. You can meet with open enrollment or life events certain things that will allow you to change your plan. But here's the catcher. Here's the kicker, Goodness. The catch with that. The premium plans and the deductibles, you have to gauge and do that mathematic breakdown. Most of the time, let's say we have 3 plans and they're all PPOs. We had something that's like Choice Plus. I won't say the exact name. It's pretty common with UHG. But we'll just say Choice Program, right? The Choice Program, if we had all 3 coverages, all 3 options had the exact same network, the exact same doctors, the exact same in-service covered prescriptions, drug tiers, everything. So the only difference was what you're paying. There's no change in service. Now, there was the POS plan. This one's a little bit different. This one functioned off of copays. This one in particular, and we could say the name because it is a public option. It's not something that's been excluded. It's called Bind, B-I-N-D, not a bondage or BDSM thing, as far as I'm told, though we often joked. The Bind program, what it is, or what it essentially encompasses. It's part PPO, part HMO. The way you could tell is that you had copay features. However, we had a network of doctors. One thing to note with that is that the style that was more keen to the PPO, since the HMOs mostly functioned off of copays, is that you had to get approval for certain services, and then you paid basically off your paycheck for those services. Now, that sounds like an HMO because you do need a referral, but it wasn't quite like that. It wasn't like the doctor was getting approved. You could go to any network facility in order to get that done, but it was charging those deductions as a form of a monthly or a bi-weekly accreditation or charge to you. And the reason that Bind is sometimes good, sometimes bad, those sorts of hybrid plans, in this particular instance, it's called a build-up option, which you might want to avoid, is that if you have surgery, and it's 5% of surgeries that are covered in the U.S., so like all of them, guys, literally all of them, except for 5%, but all, except, sans 5%, you have to get and you have to get them certified. And I don't want to say the plan fucked people over, because I'm not here to make that judgment. But the people who used the plan said it. So, whatever. I might get sued for this. Am I going to get sued for this? Oh, fuck. Am I going to get sued? God damn it. All right, anyway. So the Biden plan. It's an example of what they call a cafeteria hybrid. You can call it what you want. Some people call it just a build-up. Really, why do they call it that? Well, because it's like a cafeteria for a hospital and no other cafeteria I've been to. I guess. So you go to fix your hair and get a little bit wavy. And what happens is you pick the plan. I mean, you don't really pick the surgery. It's not like Pikachu. You got the medical necessity to get surgery. You didn't just decide to amputate your foot for diabetes or to have an open heart valve replacement because, cool. And I think the important thing to discuss next is a smoke break. So, 1 second. I realize the ultimate irony in going to smoke and then talking about health insurance and looking like a fat bastard like I do. Anyway, what were we talking about? HMOs. Okay, so yeah, HMOs are next. The POS are pretty self-explanatory. One cool thing I forgot to mention, actually, because, God, my eyes look way more like an addict than I actually am. You have access to out-of-network services. HMOs do not cover out-of-network. I was going to kind of discuss that with HMOs, but it applies to other things. So let's go ahead and just enjoy some sparkling water together. By the way, it wasn't like a joke. I know that I'm fat. I appreciate you guys telling me, like every other video in comments. I have switched to 0 calorie, 0 sugar sparkling water instead of soda, partially for my health and partially out of spite. So thanks for that. Not good. Anyway, okay. So out of network, pretty easy to equate. PPO, you'll probably get like 50% covered. What does that mean? Your normal cost, you would have had it covered by the insurance at, let's say, 70/30. They would have paid $100. Well, they're going to pay 50% of that, so they'll pay $50, and you pay the additional $50. Pretty easy concept. If you haven't met your deductible, get screwed. All right, so POS, pretty easy to plan. If you just think you're going to make normal appointments, you don't really need surgeries, honestly, probably the cheapest option for you. Sparkling water doesn't come up good. The reason POS plans, and I say that, is because a lot of times you're going to use less for your premium. There's usually no deductible. And then you're paying just your copays. Now, if you have that surgery, might be a lot of money. And they might not cover. And you might get screwed. Those add-ons are hard to do, and you gotta let them know in advance, and they don't cover emergency services, things like that. HMOs. Let's think of HMOs like living in a prison where you have full access to leave, but you have to sleep there at night. Why? Well, it's because capitalism is nothing but shackles. And beyond that, an HMO, when I say that, the idea of being encapsulated in the plan, you have a primary care physician. There are exceptions. I'll discuss those in just a second. However, if you don't go to your primary care physician, no coverage. If you think that it is covered by something other than emergency or gyno or a couple other exceptions, no coverage. Basically, you have to go and get approval. If you like your hand being held every step of the way, HMOs are great because you have a primary care physician who is expertly diagnosing any kind of issues, conditions, and or other symptoms that you might have, leading to specialist visits, referrals, etc. So, can't just go to see that neurologist. You may not be able to travel to see that specialist in another state if they're not also in that network. That does actually happen quite a bit, not only for things like bariatric surgery, which I had to tell people no to so many times, which is heart-shattering, especially when women are trying to get their life on track. And oh, God, we had one woman who'd been dieting. She was on the FAST program. She did 3 years for that. And we had to tell her no coverage. And man, did she curse at me. And I loved her for it, and not just for fetish reasons. Anyway, yeah, HMOs, pretty strict. Not going to say that they're bad. For some people, they work wonders. The better your doctor is, the better your plan is, the better your service experience would be. But that's kind of everything in the world. Ultimately, HMOs will have an in-between point for your premium. So let's say we use the example of the POS, where it's usually going to be cheaper, and we had the example of the PPO with varying rates, but usually more expensive. The HMO might rank cheaper than or about equal to the POS because it is a hybrid and it's meant to capitalize on the cheaper point of entry for your plan. So premiums usually going to be lower. You still have that out-of-pocket max most times, but here's the thing. You can do a stage dive onto your bed. I'm too old for this shit. And when you do, your HMO plan is going to usually have those restrictions that I encompassed, with these exceptions. I had briefly touched on them, but I kind of bounce around, and the reason for that is I'm usually low energy, so when I make videos between manic depression and this, not suicidal, but just overall nihilistic wandering and miasma that I'm trapped in, I like to kind of pretend like I care. I mean, I do care for you, but not for, the fat guy here. By the way, love this hoodie. This jacket, I guess. So, your HMO, some of the exceptions would be gyno or OBGYN. I don't think gyno's technically the appropriate term, but don't at me. Pediatrics, some searches and results say that pediatrics can be covered. Just depends. Life-altering or an emergency status, such as urgent care or ER facilities, usually no one's going to try and bitch about that. If they do, your HMO is fucked up. So there's examples where you can get ahead with that sort of plan. And overall, it's not bad, but it's just a lot of guidance and measures that you can't take for yourself, which, to be fair, sometimes the expert's the one that needs to be in charge. So overall, what do I think is best? Honestly, I like HMOs. Not just for the idea of thrilling an established dominance or for being controlled by a single man and or woman who may or may not be 7 feet tall and or stomp on me at night, but for the idea of having an enclosed network. Now, there's some things you could do. If you call your HMO and you let them know you're traveling for vacation, work, things like that, they might help you out. It just depends. We'll cover a couple other smaller things. They're not nearly as important as the general health insurance and some of the differences, but I wanted to kind of outline that. And of course, it really, again, depends on your needs. If you don't have an HMO access or accessible for you, because they may be region-specific, please keep in mind that if you're chronically ill, low deductible plans all the way. The lower the deductible, usually the lower the out-of-pocket max, because you're paying more on those premiums. It may suck, and you may not have access to it based upon your pay. Usually the more you make or based upon the company, you may be stuck with certain things. Try and get on that if you can. Now keep in mind that if your employer is not offering you some kind of a health benefit, whether you're full, part-time, or anything else accessible, see if you're eligible for Medicare. It does suck. It's hard to get to, but it will save people. And ultimately, that's not a bad thing. Don't think that there's any shame in being on Medicare. Don't think for a minute if you're trying as somebody, even if you don't ever watch this, if you can never get into any kind of a zeitgeist or any kind of movement, just again stress the fact that those public health benefits and public work benefits and public welfare benefits are not a mark of shame. They're not a mark of any kind of stigma. They're not a mark of failure. Excuse me. Do try and do that if you need. Now, dental and vision are a little bit different because for the most part, you pretty much just have like a PPO. At least for me, every time that we go through, you get the dental plan, the vision plan. You might choose between levels, like I've got comprehensive dental, which is just more coverage. It's the only way I can pay for braces. That's the only way that I'll get more than $1,000 per year. By the way, that's a real example of what happens. The basic doesn't cover those things, so that's why I said those things to tell you like what the difference is. I did that for you. You might have vision, and vision is literally just get with it or get out. So for me, for example, vision was I need glasses, so I'll do this, or no, I won't. And then you had vision. Vision did have 3 levels, but it was literally just you pay for frames, you pay for glasses, and you pay for contacts, or you pay for the exam only. The exam only was like 20 cents per paycheck, which is why it was so cheap, because you literally get a yearly exam. So that kind of thing. I think they actually called it like exam and materials or something to that effect. One of the two. I'm not entirely certain what the name may have been when they changed it. But yeah, dental and vision, they're offered for you. Usually you're not going to have a lot of selection. Keep in mind that your network might be the same, might be different. They might have different providers listed for different dental options. Most of the time, that's not the case. The way that most of those organizations will stagger or they'll have differences in their network is just based upon your state and based upon your employer. Your employer might go to UHG, for example, or might go to Aetna or Cigna and say, we want to give them this network. Maybe it's the Choice Network or the Ultra Plus Super Duper Mega Man versus Goku special. And that's your dental plan, which sounds violent and unnecessary, but that's what you it's what you got. That's why you work there. And so, there's really not any variables to discuss. If you feel like you need them, you need them. Shouldn't be easier to say. A couple things you can get that are always good. Short-term disability, if you can do a buy-up, if you know you're going to be sick or you have a surgery and it's going to class under that short-term disability guideline, buy it. You have access to it during open enrollment, so if you could do the buy-up and you know you're going to use it, use it. It might be like $10 to $20 per paycheck, depending on your age, your weight, your height. Actually, those factors don't apply, but your age and your job code do. They cannot use height and weight anymore, though there are evaluations for life insurance, is what I was thinking. So that and AD&D may require what is considered an EOI. It's an evidence of insurability. So the next thing we can discuss when you're doing your benefits is going to be that life insurance. Most of the time, companies, if you're full-time or even part-time, may offer a flat rate or a variable based upon your salary paycheck amount. That's considered life event, a on-death payout for that life event for your family. They may have special things that they do. I don't really want to discuss like death and COBRA. I'll discuss that later if somebody actually asks me to. But basically, the way that it's going to work is that your payout is equal to either your pay or your base pay. Maybe it's like times 2. Maybe it's 100% of your paycheck for the year, annual salary, things like that. And so you can buy extra things. If you're young and you don't think you'll use it, no need. But if you have a family to protect, it doesn't hurt to do those. Especially the younger you are, you could do like times 2 base life for supplemental life for most companies, and you're not paying that much. Sometimes it's times 1, but let's say you make $45,000 a year upon termination or upon death. Termination of life. I don't know why I use that word. When you quit life, when you quit living by maybe an accident or terminal illness, those plans would pay the full $45,000 typically. And, that's a life-altering amount of money for some people. I'm of the philosophy to burn me and just put me in a pile of ashes, and I don't need a real burial, but, funerals and things are also expensive. Just keep that in mind if you are planning that. And those life insurances, if you're, 20, 30, you're only paying sometimes $2 to $3 per paycheck. That might add up, but if you're with a company, it might ultimately be cheaper than getting something like a term or a group life policy. And most of the time, those are not really that advantageous for you if you're going to live past 60 anyway, especially if you're signing on for them now. Now, if you're more in your 40s or 50s, that's a negotiable term. That might be helpful for you. But for younger people, not as much. Go into the AD&D, my favorite subject. Love D&D. What does the A stand for? Accidental death and dismemberment. So what does that actually mean? Well, short form, it means you lost a leg, you lost a hand, or a full limb. Sometimes there's partial AD&D, which is like, I lost a finger, show off. And the partial AD&D is going to be for things like, really it is just fingers and toes. But your AD&D, accidental death and dismemberment, it's not only applying to limbs, it also applies to loss of hearing and loss of senses through eyesight. So keep that in mind. Maybe you work with heavy machinery and you just, need an extra $100,000. Not actually going to apply that way. It doesn't pay out that much just for most policies, so you're aware. So usually AD&D, it's like $3 to $4. It depends on the policy, depends on your plan. But you can do that, and it's usually just going to be like times 2 base pay, times 1 base pay. Let's go sit in the dark for a little bit. We're almost done. So you definitely want to sign up for that sort of thing. There's a couple different policies, and a couple different plans that might show up in these sorts of things. And ultimately, the decision that what you want to enroll in is obviously your own. The best way to kind of figure it out is to do some of those mathematic breakdowns and to do some things like that. Talk to your HR team. Keep in mind, if it's on a recorded line, they should have access to it. If you feel like you're misled by your HR team, file. I mean, you have disputes, you have claims process to do like a open request for change in policy. And, you could do that mid-year. You could file the dispute if you feel like there's something wrong. One thing of note is that most insurance companies have like an invisible period. If they tell you your cutoff date is like a week from now, just bear in mind that it is a week from now. But if you call afterwards, they'll probably change it. If like you're on vacation, you're injured, I'm in the hospital, I can't change my policy. That's a real thing. We gave them like 2 weeks for that. That sort of thing happens. I guess the final thing I'll discuss, because I'm just kind of compiling information. Unfortunately, this isn't going to be segmented because it won't let me do that on my channel. Because God is merciful but hateful. We will go over, I think, maybe. Why not? Let's go over qualified status changes. Qualified life events, as some people call them. My favorite topic. I stepped outside, which is great because there's a beeping truck here. So I'm just gonna... Oh, that's soaking wet. No, I'm not. I don't have a towel. I was recording a YouTube video downstairs. Mm-hmm. I'm like, how long is this video gonna be? It's already an hour long. Which is like, Jesus fucking Christ. I'm talking about health insurance. And then I heard the beeping and I'm like, you're really ruining the ASMR content of my non-ASMR content, assholes. Jesus Christ. Okay, let's talk about qualified status changes. First thing to know is that some qualified status changes have different timeframes for when you can actually call to report. Please keep in mind that for most qualified status changes, the exception being things like birth or adoption, where you actually are inducting new life into your family, it's not going to be the same day. It's the first of the month. So keep that in mind and plan it accordingly for your healthcare. Now, let's say that you had a life change on the 14th of August, right? And you had your husband gain eligibility for a new plan, and you're going to go on that plan. That plan may be effective 8/14. Your plan will not end until the end, 8/31. You're off the plan as of 9/1 for most companies. They might be able to do retro and things like that, but it's not often the case. So just bear that in mind when you're doing qualified status changes. That's the first thing. The next thing, just a quick list of things that might be considered qualified status changes. birth, adoption. It could be like you're giving family members gaining legal custody of someone. So we would count that as or legal custodianship. We'd count that as like adoption or fostership. A change in your husband or your spouse's plan. It could also be a domestic partner. Please keep in mind that the definition of domestic partner is classified by your state and oftentimes by your employer and may require additional paperwork the same way that a marriage certificate may be required. Now, you'll have to go through dependent verification for most employers if you're adding or if you have for the first time added a dependent. That applies for medical, dental, or vision in most cases. Life insurance, not as much, but if you're adding a spouse to your life insurance, you do often have to complete that evidence of insurability that was mentioned before. Now, in addition to things like that marriage, it does also apply to divorce because 56% of Americans. And when you go through that, you might have 30 days, you might have 60 days. It just depends on the reporting status. They will tell you what your usual freedom for that will be. And it'll usually be on like your eHub or your internal networks. It just depends on where that'll be. Just follow that and just adhere to whatever their guidelines are for that. A couple tricks with it. There are some I don't want to say hidden, but less known qualified status changes, which usually apply for most networks and for most jobs. Things like a change in your daycare situation. So let's say, for example, your COVID-19 has allowed for you to stay at home and you're no longer needing a daycare, then you can possibly make changes to your FSA. You could possibly make changes to your healthcare, depending. They probably won't let you do add or drop on dependents for healthcare, but just check with them. It's always a good option just to see. Most of the time, adding dependents is done when there's a change in plan where they lose eligibility from another plan. So what that means is if your husband gains eligibility for his work, you probably can't add him. You could drop him from yours, you could drop yourself from yours, you could drop your kids, but you probably can't add your family to your plan because you already had the option to and you failed to do so. The fact that you're gaining eligibility or he's gaining eligibility allows me to fix my hair mid-sentence and doesn't allow for you to make the change. In addition to qualified status changes for things like the change in your daycare operation, it could be a change in your address, which results in maybe a different plan that's no longer eligible for you. And you could pretty much pick and choose again for that. There's been certain things that the IRS and recent federal acts of stimulus has allowed for, either changes to your current plan, changes to COBRA plan, which is a whole mess of a situation I don't want to talk about. But basically, COBRA is just the Continuation Omnibus Act. I can't remember the full extension. COBRA, it's a snake. COBRA allows for you to continue your medical plan for eligibility for up to 36 months, depending on Medicare eligibility, 18 months if not Medicare eligible technically, or most of the time. COBRA is usually the full cost of premium, so it's pretty expensive, honestly. But those sorts of health events or those life events can be used to modify what you might have. And again, birth is special, as is adoption or fostering, because it's same day. Birth is one of those things where you could pretty much change the whole damn plan. You can say, I don't want this low deductible. I'm going to go to the HMO and switch it over, and your family's there. Now, it might take anywhere from 5 to 10 business days to update those plans, so just keep that in mind accordingly. But those are examples of some qualified status changes. Always check. If you feel like you might have an option for a change, you could speak to your HR team, or you could speak to whoever is internally managing your benefits, and they might have access to do the modification. Also, keep in mind that open enrollment is not guaranteed to be at the end of December into January. Most of the time for matriculation, which is just the entry of that paperwork or information, your company may have it in September, October, November. I've seen it pushed in towards the December month, but for the most part, we were trying to do like September, October, and that just happens to be how it usually goes through. Now, when you go through open enrollment, they give you all the paperwork, the packets, and all that information. If you have questions, you can certainly call. Just please be mindful of the fact that a lot of those information pieces, they can't give you advice on. I do hope that this helps in some capacity, but I'm sure that a lot of it might be scattered. If you have questions, feel free to give them a comment down below. I will be happy to answer. And I'm going to try and do more experimental freeform longer videos, knowing that they won't get any views. But if you watched to the end, feel free to comment your mom's credit card account information and send me V-Bucks. Or don't. More realistically, have a great night. Thanks for listening if you watched even a minute of the video. Even a second. Hey, everything's a margin. Appreciate your time, and stay lovely.